Welcome to this short video about the MRCGP AKT, what to expect and how to prepare. My name is Muhibur Rahman, I'm the Medical Director of Emedica. So let's start with an introduction to the AKT exam. So the very basic thing is that AKT stands for Applied Knowledge Test. It's actually quite important, so there are no sort of pure theory questions or pure recall questions. The AKT is about applying knowledge relevant to UK general practice. So it's testing more than just simple remembering of facts, but being able to apply them to cases and to general practice. So the exam consists of 200 questions in 3 hours and 10 minutes. It's available 3 times a year, so you can sit it in October, in January or in April. You can sit this exam in your ST2 or your ST3 year of training, so you can't sit it in ST1. And the default maximum attempts is 4. However, it is possible, if there were extenuating circumstances, to ask for an exceptional 5th attempt. Let's start by looking at the exam format. So the first thing is that the entire thing is done on computer at one of several Pearson VUE test centres. These are available all over the country. The way that the questions are laid out is that there's one question on each screen. You can go back and forward, you can change your answers, you can check answers. Let's say you weren't sure, don't leave a question blank, have a guess anyway, but you can mark it for a review using the flag symbol, and then you can always come back to it at the end, so that if you finished and had a few minutes left, rather than looking over 200 questions again, you could just look over maybe the 10 or so that you were unsure of and had flagged earlier. There are lots of different question formats, but the 2 main question formats are extended matching questions and single best answer questions, with single best answers being slightly more common than the extended matching format. The other question formats include things like algorithms, picture questions, multiple best answers, questions testing your knowledge of seminal trials, videos, short answer, lots of formats, and we'll look at some of the question formats in the next video in this series. You'll be given on the day of the exam a laminated piece of paper that you can use with a board marker if you want to make any notes or calculations, and there is also a basic on-screen calculator if you need to use it for things like drug dosage calculations, things like that. Now, in terms of the subjects covered, all of the material is drawn from within the GP curriculum. However, the questions are spread that 80% of the questions, so 160 questions, are from the clinical medicine domains, all relevant to UK general practice. So that includes all of the kinds of things that we could see both in hours and out of hours. Everything from pediatrics, women's health, men's health, sexual health, cardiovascular, endocrine, everything that you could see as a GP. 10% of the questions are from the evidence-based practice domain. So this includes things like statistics, research methods, types of study, critical appraisal. And 10% is the organizational domain. This includes things like types of practice contract, administration, different forms, statutory duties of a doctor, GMC guidance, and so on. Now the clinical questions, they'll relate to one or more of these things. So some questions will be about disease factors. A patient is worried about breast cancer because the mother's been diagnosed. Apart from family history, which of the following are risk factors? Some will be about making a diagnosis. A patient's presented with this and this symptom. This is the examination findings. What's the likely diagnosis? Some will be about investigations, maybe which tests you do on that patient to confirm your differential. Some will be about management plans, and these can be broad, so it could include, for example, who to refer within 2 weeks, who to admit today, who to have seen within 24 or 48 hours, or who to manage within practice. Some will specifically about prescribing and prescribing safely, and that could include, for example, drug interactions, knowing about monitoring for certain medications and so on. And then some questions will be about emergency care. Remember that the GP curriculum doesn't just include what we do in hours, but also those things that we include out of hours. Now the questions will include those things that are about low impact common conditions. So for example, musculoskeletal low back pain, viral sore throat, diabetes, hypertension, acne, eczema, but also high impact but rarer conditions. You may not see someone with cord equina more than once or twice in your career, but it's very high impact. You might only see someone with a sore throat related to a head and neck cancer once a year, but it's high impact. And the common reasons for consulting, which could include things that are outside illness. So for example, questions on contraception, questions on someone requesting sick notes and things like that. And the pass mark and the pass rate is variable. This is a standard set exam. So each sitting has a set pass standard. Everyone above that can pass. And the pass markers range from as low as 66 to as high as 71.5%, with the long-term mean around sort of 68 to 69%. And the pass rate long-term is just over 73.5%. So how are you going to prepare for this challenging exam? Well, it's really important that you try to make your learning active. Try to do a combination of reading, going through the curriculum, reading your core topics, but also practicing questions so that you get used to answering questions in the correct format. A really important factor is to allow enough time to prepare. So most candidates are going to need sort of 3 or 4 months to prepare. Some will spend a bit longer because perhaps they've got a very busy job and lots of other commitments outside of work. You want to focus your revision to maximize your marks. So remember that the statistics and the organizational domain, they're only 10% each. They're areas that people traditionally do less well in than the clinical, but they're well circumscribed. If you focus well on these, it's possible to get a very good mark, and that will allow you to give yourself a good head start. It's worth looking at the examiner's feedback reports from past exams to look at weak or important areas that candidates didn't do well in previous exams. They usually retest these in future exams. The most important thing to remember is that the bulk of your revision time should be spent on the clinical domain, because this is where 160 of your 200 questions are going to be drawn from, and it's the largest part of the curriculum. So you need to spend most of your time covering this systematically. So what kinds of things are going to help you in your reading? Well, if we look at the core text, the Oxford Handbook of General Practice will allow you to cover a large chunk of the clinical material, some of the organizational and so on. However, even the most up-to-date version of that is out of date for guidelines. You need some other source for reading guidelines, and useful source is the guidelines book shown here. For statistics, the Medical Statistics Made Easy is a really good resource. It covers the bulk of the statistics that you need for AKT at more than enough of a level to do really, really well at. And for the organizational domain, there's no one place where you can get all of this from. A lot of it will be covered in our online course. However, sometimes you'll find some of this from the GMC website, some of it from the DVLA and various other resources. Other useful things to look at, it's worth looking at the examiner's feedback reports from past areas, because this will highlight some of the key areas that either were important or people didn't do well in, and these topics frequently reappear in future exams. The MRCGP Essential Knowledge series, so the knowledge updates give teaching materials based around important topics that are often tested, and then the knowledge challenges have AKT style questions that you could use as part of your revision. Now, alongside the reading, most people will use some form of online revision package. And so some of the popular ones are, the Emedica online service, Past Medicine, On Examination, and then RCGP has got the self-test, which you can get a free trial to as an associate in training. So, most people use one or more of the online resources so that they can practice questions alongside their focused reading. And actually, it's really useful to do questions from different sources so that you actually get used to different styles and make sure that you've actually learned the subject rather than just learn that particular question, because you're not going to get a repeat of that question. You're going to be tested on the subject matter, on the different topics. One of the other useful tools for covering the often questions on drugs, interactions, things like that, is actually to look at some focus reading from the BNF. So the first few pages cover things like principles of prescribing, prescribing in palliative care, pain management. That's worth looking at, and perhaps the first page of each chapter of the BNF will give you a good summary of the important drug classes. So to summarise, remember that the AKT is about applying knowledge relevant to UK general practice. The organisational domain is actually the area that GP registrars do worst in terms of looking at the data from past exams. Evidence and statistics can offer some easy marks. It's a difficult topic for some people. It's something that people often don't like, but if you learn it well, you can get a good score and that can boost your chances. However, the clinical is the most important domain. It is the most common reason for people to fail, is that they don't get a high enough score in the clinical. And that's because it's weighted 80% of your overall score. It can be useful to look at examiners' feedback reports from past exams to help you think about some of the areas you want to make sure you've definitely covered. But one of the things to remember is that it is a challenging exam and it is a large curriculum. So make sure that you leave yourself enough time. Absolute minimum is 2 months. Perhaps if you had a quiet job where you could do some reading while you're at work, 3 to 4 months is better for most candidates. And some people, will want to start earlier, maybe 6 months, because they're going to start early and do a little bit slow and steady and sort of start intensifying as they get closer and closer to the exam. So I hope that's been useful as an introduction and an overview to the MRCGP AKT. In future videos, we're going to look at some of the question types. We're going to look at common mistakes that can lead candidates to lose marks and fail the exam, and most importantly, how you can avoid them. So I hope that's been useful. If you have found it useful, please do join us for the other videos in this series. Thank you so much.